Good afternoon, everyone. My name is Doris. I'm a nurse that I've worked in several different areas. I've worked with the transplant centers. I've worked at dialysis with dialysis patients. And now I'm on the other side working and teaching kidney patients, kidney disease patients, helping educate them and helping them learn about the process. And I'm going to talk to you about transplant. Well, I was going to say, you hear all these stories, everybody, you're on dialysis, you want to get a transplant so you can get your life back. So what do we got to do to get transplanted? I wanted to give you a little bit of some statistics first. There's over 100,000 people waiting for an organ. Of those 100,000 people, there's about 88,000 people waiting for a kidney. This is nationwide. But even all those people waiting for a kidney, like somebody said earlier, half of them are not ready to get that transplant. About half. So half of them are listed as active, which means when you're active on a transplant list, yes, they can call you and you can get a kidney. You're ready. You're on that list when somebody either passes away or something, you can get a kidney, you can get that call. But if you're not active on that transplant list, there's some reason you probably have to do some additional testing. If you're sick, they want you to get better. So those are things that we got to, do. So when you go and you want to get a transplant, you got to be ready. Okay. Last year, according to UNOS, there was over 25,000 kidney transplants in the US. So we need to get that number up. If there's, 88,000 people waiting for a kidney, it's, that's why we're trying to educate people, become a donor, ask family and friends, or tell your story, get stories out there so more and more people know about kidney disease. And then we can get that number up. So kidney transplant. A kidney transplant is an opportunity to get your life back. It's a treatment option for kidney failure, okay? You got to remember, this is not a cure. Kidney disease does not have a cure right now. They have not been able to find that cure. There's all kinds of research going on and trying to do different things, but right now, we don't have a cure for kidney failure. Kidney transplant, it's the best option for kidney failure. Dialysis also keeps you alive so that one day you can maybe get your kidney transplant and keep going. It's an opportunity to get your life back. Do the things that you want to do and travel, and do everything, even though sometimes you can still do that on dialysis, but it's a lot harder, as we've heard some of our stories. It is a major surgery. It is. So that's why we have to be ready and as healthy as we can. Take care of ourselves. You got to be ready. So what do we got to do to get on a transplant list? Some people, I've heard patients tell me, yeah, my doctor referred me, I'm on a transplant list. The first step is getting a referral. Of course, you want to get your name on their radar, on that transplant center's radar. But just because you're referred does not mean you're on the list. You have to be evaluated. And all these transplant centers have certain criteria that they go by, okay? So they're going to get your records, they're going to evaluate you and see if you're a candidate, okay? You're going to go through all kinds of testing. And then they get all these results and all these tests, and then they're going to see if you qualify. Going on dialysis or kidney failure involves, you have high blood pressure, you've had diabetes or some other problems. All those things take a toll on your body. So we got to make sure you're in the best health possible. And that's why one of the things that we really got to do is take care of ourselves as much as we can. What can we do, right? Of course, coming here, being here online or in center, educating yourself, learning everything you can about kidney disease, about dialysis, about transplant. That's the first step, you know, getting your story out there, learning whatever you can, and then staying as healthy as possible, getting your physicals done every year. You know, women, we get our mammograms, men do their physicals. There's certain tests involved in that, things that we don't want to do sometimes. But we got to do it. We got to keep ourselves healthy as we can. If you have diabetes, keep your diabetes under control. If you have hypertension or high blood pressure, trying to keep that under control as best you can. You know, if it's not under control, you got to go back, be your own advocate and tell your doctors, hey, you know, my blood pressure's not under control. I got to, you know, what can we do? So you got to be your own advocate. You got to, you know, talk to these doctors and tell them. So yeah, once you're referred to the transplant center, you know, you'll get a call. They're going to review your situation. They're going to ask for a bunch of tests. You know, don't get too weary about it. It's a lot sometimes being, let's say, on dialysis, or, you know, and still having to go to all these doctor treatments or more tests and more evaluations, but just take it one step at a time. You know, things that you got to do, little hurdles, but you just look at it one thing at a time and go and keep going. Because once you're evaluated and you go through all the steps, you might have to, you know, see a nurse, see a social worker. They'll check your financial situation, check your insurance, see what you got to do. Like, can't remember her, but they had said there's all kinds of resources out there that are able to help. You know, if you need to fundraise, if you need a little extra help, sometimes you need a little help with medication. There's all kinds of resources that are able to help out and get you to where we need you to be so that you can get the transplant. You know, make sure that you go to all your appointments. You do everything that you can. You're going to your dialysis treatments, you know, that's going to help you stay healthy. You know, keep that waste out of your blood. You're going to go to your appointments for the transplant center every year. Yes. You know, and sometimes it takes 4 or 5 years waiting for a transplant, but you're going every year. They're going to see that you're interested. You're going to take care of that kidney once you get it. So it's really important to take care of yourself. Going to your appointments, having a support person, you know, that's real important too, because all these things that we got to do, and, you know, it's a lot going through dialysis, getting these treatments every other day, or if you're doing it at home every day, you know, having somebody that's there for you, that can help you every now and then, encourage them, you know, keep them active, involved in their care, you know, make a schedule. You got an appointment here, you got an appointment there, let's go there. It's hard sometimes, but it's the little commitments now that's going to help in the long run to get you where you want to go. So like I said earlier too, there's all kinds of resources. You got to educate yourself. You got to want it. If you want it, you got to learn it. Whenever you want something, you go out and you learn about it. So you want to, you know, all kinds of resources online. There's great places. EMAT is out there helping everybody too. All sources, you know, get your story out there. Talk to friends and family, churches, you know, there's so many resources online, even friends, family, anywhere. Talk to others that have been there. Like we've had today, we've had all kinds of patients that have told their stories. Amazing. They all know, you know, they've been there, done it. You can talk to them. If you have hurdles, like there's patients that have had 3 transplants, and they'll tell you their hurdles. They'll tell you what they did. It might help you, you know. So then once you get there, you can pay it forward and tell them your stories as well. And that's how we keep the cycle going. To finish off, I just try to stay positive. Life happens sometimes, but you keep on going. Yes, you got to stay involved in your care. Look at the bright side of things. You know yourself best. So you got to just keep going. Thank you. Now, do I have any questions? If going, on dialysis treatments, if there is services offered to help with like emotional stress or, things that we all go through. And yes, all dialysis centers do have a social worker, and they should be talking to their patients, while they're on dialysis. And it's really up to the dialysis patient yourself, getting what your needs are expressed. The doctors see you as well, and you can get referred to a therapist if you need that. But a lot of times I think we keep stuff inside. We don't really tell, what's going on, or we're having issues. I've seen that a lot, but you want to get it out there. And sometimes there's all kinds of support groups, these groups, there's all kinds of support out there for patients on dialysis, for kidney patients, for transplant patients. If you go online and those resources, you can get on and connected with people that have been in your shoes or been there and can help you with some emotional, and then if you really need some additional help, you get the help that you need. Okay.
So it's just more of a comment on what Doris was saying, being a nephrology nurse, being more involved in your health. I will tell everybody this one thing. When I was first diagnosed with kidney failure in my 20s, my first nephrologist let me know, he says, Delisa, it's one of me and it's many of y'all. And right now, kidney failure is growing at an alarming rate, and nephrologists aren't growing at that rate. What you put in is what you'll get out. So that made me more of a person. I'm going to read, as Doris said, and look up information. So when I come to my nephrologist, I have questions to let him or her know I'm going to be involved in my health. And because of that, they work more for me.
Thank you. Yeah, it is being involved in your care. When I was at that dialysis center, like Amanda said, she's out there for her patients. I was out there. I was talking to these patients. I was wanting to help them so bad, but I can only do so much. If you can't help yourself, if you can't, I can bring you to the water, but I can't make you drink it, So it is you wanting it. I tried so hard sometimes, and I myself would get frustrated because these patients, I said, let's do this. I try to be, positive and friendly and I know it's hard because I'm not on that other side and I'm not in that chair, doing that dialysis, but I was trying to get them off dialysis. I had patients tell me that they were not feeling well, or they wanted support, or they wanted to share emotions. And I started a support group and I didn't get hardly anywhere because patients wouldn't come. They wouldn't come. And so I did it for one patient, and I invited him every single time, and I never saw him. But, sometimes you do reach, you put the word out there and you reach 5 or 6, and maybe you get one, it was hard. But yeah, being involved in your own care and wanting it is so important. Like she said, we can only do so much. You got to also put your part. Got another comment question?
It's a tag teaming. So when Doris said she tried the group didn't work. What did she say? Because she hasn't experienced it. So I too am a nurse, and I end up being a dialysis nurse. And I went into the clinics, and looking at me, you'll think she does not have anything wrong with her. So I used to go around to each station, talk to the patients, but my workers knew, my CCHTs knew, so those are the dialysis technicians, the managers knew, until one day the patients kept saying, nurse keeps coming around here talking to us and she has no idea what she's talking about or what we're going through. So they would hear the rumbling. So one day one of the patients was speaking and they said, guess what? The Lisa knows. And they was like, how does the Lisa know? Well, she's had a transplant. Let's talk to her. And that is some of the issues that we're dealing with in the community. The healthcare professionals, they do as much as they can do, but they don't have that experience or what the patient is going through in that chair. As I would tell them, I've never done hemo, so I don't know how it feels to do that part every day, but I have done dialysis. So I understand that inconvenience in your life. You wanted to go somewhere, you can't go because, hey, I have to do dialysis. I want to work, I can't work, why? I have to do dialysis. So through this and what EMAT is doing, that's what we're trying to do. Get the word out there, give that connection that, hey, somebody knows what you're going through. Reach out, we're always here. Healthcare worker Doris, office manager, Amanda, we're here. That's all we want everybody to know. We're here to help you with this transition. Is it rough? Yes. Is it doable? Yes. Will we all make it? Yes. We'll lose some along the way, unfortunately, because that's a part of life and we don't want to lose anyone, but we have to accept that reality. But we want to make it as doable as it can be for one that's going through this process.
So the question was, why is there so many people with kidney disease, maybe going through dialysis and so forth? I think a lot of it is educating, getting ourselves educating. I teach a lot of my patients about diet, health, lifestyle habits that we've just grown up with, since the revolutionary times where fast food became a thing, and all these processed foods and things that we've just done, and our lifestyles are so fast and we make things, we want everything to be quick. We've damaged ourselves and caused a lot of disease. So high blood pressure, diabetes, which all leads to kidney failure. So it's educating on yourself and eating right, staying healthy, exercising. Those are the things that I believe has gotten us where we have a lot of kidney problems and other diseases and stuff. Thank you.